Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. November is Lung Cancer Awareness Month, and there's some very exciting medical news for those patients with advanced cancer. There's a new blood test from Guardant Health. It's the first FDA-approved comprehensive liquid biopsy that offers hope to lung cancer patients and their oncologists. Dr. Reyes with the Memorial Cancer Institute and his patient, Lynn Spadaccini, are joining us here with more on the program. Welcome, both of you. Thank you.
Thanks for having us.
Dr. Reyes, tell us about some of these recent developments in treating patients with advanced lung cancer, if you would.
The most important thing is that we are switching from empirical chemotherapy to personalized medicine, meaning that we are choosing the right treatment for the right patient, and it's a customized treatment. The way that we do that is we do now a genetic analysis, a molecular analysis of the tumor of the patient, because now we are lucky that we have 9 FDA agents approved for lung cancer. And the only way to know which of these 9 agents that are oral agents, non-toxic, non-chemotherapy, we call them target therapy, is to do a molecular analysis. Today we are talking that we are very happy that the genetic analysis can be done in the blood, as you mentioned, the FDA approval, so we can customize the treatment for each patient.
Now, how has this the prognosis for these patients evolved during the past 10 years or so?
It has improved tremendously. With palliative chemotherapy, the survival was very limited. It was very hard to talk about years. But now with this oral target therapy, patients can live several years, and probably we're curing a lot of them, but we still don't know because there are new therapies. We need to wait. We have people taking these oral agents now for 8-9 years. And the quality of life is great because they live a normal life. The toxicity profile is minimum. They don't have to endure chemotherapy side effects, so they can go back to their normal lives and only take 1 or 2 or 3 pills a day.
Now, Lynn, I understand that you're a patient. When you learned that your particular lung cancer had progressed to stage 4, what was it that gave you hope?
What gave me hope was that I had educated myself and I'd read a lot about lung cancer, and I realized that there were lots of new therapies coming out, and I realized that personalized medicine was now real. And so I was hopeful that some of the personalized treatments might work for me.
Doctor, what made Lynn a perfect candidate for such treatment?
We ordered, when we met Lynn, a liquid biopsy, and we were able to discover in her lung cancer a gene called EGFR, and the FDA has an approved agent for this gene. So Mrs. Spadaccini is taking now oral target therapy for several months successfully with a very good quality of life.
So what were some of the challenges? Was this particular gene, is that a challenge for other patients if they have or don't have that particular gene or some other circumstance?
15% of all the lung cancers in the United States, there's 30,000 people, carries this gene as responsible of the lung cancer. So the only way to benefit these 30,000 Americans is do the genetic analysis in the blood or in the tissue, and in that way they can benefit that we have more than one agent approved for this type of lung cancer.
Lynn, talk about how you and Dr. Reyes work together in identifying your appropriate treatment, if you would.
When we first met, he suggested that we do a blood biopsy. And so right then, they drew blood, and we did the Guardant 360 test. And, of course, the results come back very quickly, and that's how we were able to find that I have EGFR. So working with him, he immediately suggested that we do that, and I was lucky that we found that EGFR and I could take personalized medicine.
Doctor, is it possible to be treated without genomic profiling testing being done? Is that possible, or is it crucial that that testing be done before starting this treatment or any other?
No, it's the molecular profiling helps us to identify the gene that is responsible for the lung cancer. All the pharmaceutical industry does developing of new agents. They develop new agents for this specific gene. So that's why these target agents only work for that specific gene. And today, we still haven't replaced chemotherapy in all the patients because we know of other genes responsible of lung cancer that we are still in developing target agents, and that is why we're still using chemotherapy in a number of lung cancer patients. But as soon as we discover and FDA-approved new agents, we are going to be replacing one by one all of these treatments that are palliative and empirically for a personalized treatment.
Lynn, talk about how you're doing today.
I'm doing really well. My quality of life is the same as it was 5 years ago. I feel good. I have energy. I can walk, run if I want to, travel, do anything that I've ever been able to do. I feel good.
What would you say to others who are faced with similar circumstances such as yours?
I would say make sure that you find an oncologist that understands lung cancer, and that I would also push to have the genetic testing done, because that way we can decide what treatment is going to be best. I think you need to educate yourself, learn as much as you can about your cancer, advocate for yourself, and I think have hope. There's lots of treatments available, and there's a good chance, perhaps, that personalized treatment will work for you.
Doctor, you mentioned the outlook for patients undergoing this treatment. What do you see for genomic testing in the future and for Guardant Health as far as this technology is concerned?
The genomic testing has to be comprehensive, and the type of test that Guardant Health and other platforms do is very comprehensive. And the reason is to be comprehensive, meaning that we know that today at least 75 or 80% of the genes responsible for lung cancer, but the 9 agents that we have approved by the FDA only covers 30%. So that is why we need this comprehensive testing, because even for the genes that there are no treatment, we have clinical trials. We have agents in development. So the patients can have a standard of care, oral therapy, and then even if they fail, they do not necessarily have to go to chemotherapy. They can go to one of these clinical trials. That's why the genetic testing, when it's comprehensive, not only give us information for agents that are FDA approved and available, but also they give us the possibility for the patients to go for the clinical trials and still benefit for agents that are going to be approved in the next years. As you know, clinical trials have been very successful. Every year we're approving 2 or 3 drugs for lung cancer. So these trials we have a lot of hope in these trials.
Where can our listeners go and learn some more, Doctor?
For example, we're talking about liquid biopsies today and Guardant Health. They can go to the website, but the most important thing also is ask your doctor. If you're a lung cancer patient, you need to have a genomic profile. That's really a standard of care in 2020, and I want to give you thanks for empowering the patient with this information to do that.
And their website would be www.guardanthealth.com. That's GuardantHealth.com. Is that correct, Doctor?
Yes.
Well, I thank you both, Dr. Reyes, and I thank you, Lynn Spadaccini, for joining us here on Health Professional Radio this morning.
Thank you.